Welcome to an educational video produced by the Neurosciences Department of King's Health Partners. Today's topic is on thunderclap headaches, causes, symptoms, and management. My name is Dr. Kit Wu and I am a King's Health Partners Darcy Fellow. Our learning objectives today will include the definition of a thunderclap headache, how common it is, what are the causes of a thunderclap headache, both the common and the rare ones, the symptoms, how we diagnose it, and the initial management. The definition of a thunderclap headache is an extremely painful headache that comes on suddenly, like a clap of thunder. This type of headache reaches its most intense pain within 1 minute and lasts at least 5 minutes. Thunderclap headaches can strike without any warning. Some of these are caused by benign problems, but they can also be a sign of a very serious underlying condition that involve bleeding in and around the brain. It is therefore very important to rule out life-threatening causes of a thunderclap headache. Thunderclap headaches are rare and occur less than 50 per 100,000 adults per year. Some thunderclap headaches have no known cause. Others occur because of a problem with blood vessels in the brain or due to injury or heavy exertion. Causes of thunderclap headache can include subarachnoid hemorrhage, which means torn or ruptured vessels in the brain, reverse vasoconstriction syndrome, other intracranial hemorrhages, such as bleeding blood vessels, which can cause a stroke, brain aneurysms, pituitary apoplexy, or arterial dissection. Some of the uncommon causes include space-occupying lesions, such as tumours, infections such as meningitis, inflammation of the brain or the blood vessels, such as temporal arteritis or cerebral angiitis. And other causes are CSF, hypotension, or cerebellar infarct. The main symptom of a thunderclap headache is a sudden and severe pain in the head. The pain reaches its most intense point within 60 seconds and lasts at least 5 minutes. Other symptoms include nausea, vomiting, sensitivity to light, sound, and smell, which may confuse you with the diagnosis of migraine. The patient may feel that their neck is stiff and thought that they may have meningitis. If during sleep, the pain will definitely wake you up. In terms of investigations, this is a sample diagnostic pathway of investigations of a thunderclap headache. Traditionally, it starts with a CT scan of the head. If there is subarachnoid blood present, then patients may need to proceed to a CT angiogram and subsequently refer to the surgical team. If the CT head is normal, then they may need to undergo a lumbar puncture. Depending on whether there is the presence of processed blood cells called xanthochromia, they may either need to go through further investigations. If the patient is unable to go through a lumbar puncture, then we can also proceed to further investigations such as an MRI or an MRA. And if everything normal but symptoms still present, then these scans may need to be repeated. Treatment principles will depend on the cause. If a thunderclap headache is not associated with an urgent underlying condition, medication is often enough to treat the symptoms. A non-steroidal anti-inflammatory medication can help reduce swelling and inflammation. Drugs can be used to manage blood pressure. If the thunderclap headache is caused by spasm in the brain's blood vessels, we can use IV or oral nimodipine. Some thunderclap headaches require surgery to repair torn or ruptured blood vessels or remove a blockage. and therefore will require input from neurosurgery. Thank you very much for listening to this talk, which has been produced by the Neurosciences Department of King's Health Partners.